Every person in my life that gets vaccinated is like one more person I don't have to worry about dying. What's hard about this time is that the patients are significantly younger. There's a lot of anxiety around all this. My name is Avery Taylor, and I'm a nurse manager at Houston Methodist Continuing Care. In a normal world, I would normally get here at 6:30 and leave by 4. Right now, I'm getting here like between 6 and 6:30, and then like last night I didn't leave till 9. I'm trying to not do that. Today, we are on 2 East. Sometimes we're HIDU, sometimes we're not HIDU. Right now, we are full on HIDU. HIDU stands for Highly Infectious Disease Unit. So we opened these units in the March of 2020. Unfortunately, we are in the midst of 2021's COVID pandemic. We work as an overflow unit, and we're pulling patients from those hospitals that are really needing the most help. Good job, I love that. Is there any equipment or supplies that we don't have that you guys are needing? The majority of our patients under the age of 50 are unvaccinated, like 90+%, all right? Our older patients, I'm meaning like anybody over the age of 60 with comorbidities, other things going on, it's about 80%. But the majority of our patients, unvaccinated. I think the previous surges we I felt like at least a little more emotionally prepared for them, because I think we were all pretty convinced that we were headed towards some sense of normalcy. Like, we didn't have COVID patients in the hospital. We had flipped our unit. Like, we really were not a COVID unit anymore. We went from running 24 LTAC beds to flipping that unit to take care of primarily COVID patients, and then hiring enough staff to open an additional 20 beds to be primarily COVID patients also. And all of that happened within 2.5 weeks. You know, we have some new fresh faces, which is helpful, people who have maybe taken some time off. But for our people that have been here from the very beginning, we're tired. And then we have Yvette as like a resource person, but I'm not sure where I'm gonna put her. Humans are finite resources. There's only so much you can do for so long. And nurses are really, really good at digging down and pushing through. I know that I have done that really since March of 2020, of just like put my head down and work, because it felt like the right thing to do, that all that kind of catches up with you eventually. And so beginning of February, end of February, I started having panic attacks. I'm very good at compartmentalizing my family, but I was not very good at compartmentalizing my work. Like, when I'm here, I'm very much here. I'm not necessarily thinking about my husband, I'm not thinking about my kids, I'm just here. But when I'm at home, I was still thinking about here. I couldn't stop thinking about the patients. What's hard about this time is that the patients are significantly younger, and they are really sick. And what I'm finding about younger patients is they're not used to being hospitalized. They don't know what it's like. There's a lot of anxiety around all this. There's a lot of family anxiety around being hospitalized with COVID. It's a lot of anxiety. One of the things that's been really hard about this is I have family that's not vaccinated, and we've had some very hard conversations. I have small children. I think it's a very nuanced conversation that it's easy to make not nuanced. I feel very confident in the science. I feel confident in experts, right? One of the interesting things that when I talk to people about getting vaccinated, the argument I get is, oh, well, everything changes. They make this recommendation and then it changes, right? That's science. Like, when we learn something new, the recommendation is going to change. When we started this unit, staff were only wearing masks in the rooms. We weren't wearing masks out here. It was really before there was any recommendation to be masking unless you knew you were in a room with a COVID positive patient. So that was a really hard change for us. We ended up taking Polaroids of people's faces so we knew what they actually looked like. We've also learned how to take care of ourselves better. We're taking more breaks. We're realizing that this is obviously a marathon and not a sprint. Growth is important, and especially when you're dealing with something that's novel, you can't expect what you do at the beginning to be doing at the end or in the middle. You have to change, and patients will be better for that. We can't change people's minds. I don't know how we get anywhere. So my hope for this, my hope for the ending of this is that people will wear masks again until we can get boosters and the people we need to get boosters in, and until we can convince people to get vaccinated. But we have to get this under control. It is going to affect schools, and it is already affecting hospitals. I have a 3-year-old and a 6-year-old that can't be vaccinated, and I've had to make some decisions about, who I want around them and how do I keep them safe. Right now, we're not having our kids around anybody that's unvaccinated. And so that has led to some really hard conversations in my family, because we've had to tell people who we love and we love to spend time with that, like, right now, we can't see you in person. And I think that that's extra hard because we've already done this. There's 5 of us, and my older brother is vaccinated. I'm obviously vaccinated. And then my youngest brother is vaccinated. And then my 2 middle siblings, my sister and my brother, they're just not comfortable. They can't really give me a good reason, but my brother just called me this morning to tell me that he's gonna get vaccinated. He made the decision, his next day off, he's gonna go. What he doesn't know is I'm gonna go pick him up and take him. Every person in my life that gets vaccinated is like one more person I don't have to worry about dying. And I know he's young and I know he's healthy, but let me tell you, I have patients in these beds that are young and healthy. It just means a lot to me that he's like willing to do it, and like he can go off my list of people that I have to worry about. Like, it's a big deal to me. So I'm very happy about that today.